Good morning, good afternoon, good evening. Welcome to Sattvic Toastmaster for Healthy Living. It's all about you. Love starts with you loving yourself. Health starts with you loving yourself the way that you can be. Love yourself the way that you eat healthy, sleep healthy, and be healthy. It's all about that. And once you are healthy, I think you can make the entire nation healthy. That's what Sattvic Toastmaster stands for. Sattvic as a word means Sattvic, living on truth, means believing in truth, eating the right food, doing the right thing, believing in right thing. That's all it means. And don't we in Toastmaster also believe in the core values, integrity, respect, service, and also the excellence. Once you follow these three principles, excellence is something that has to happen, which is why it is the fourth value in Toastmaster. Well, talk about a lot, but today's we are going to have an interesting topic, a topic on how to maintain our health. We have a keynote speaker who is joining and it will be introduced by the Toastmaster of the day. But for now, let me introduce the presiding officer for today, Toastmaster Varunda, an energetic lady joining from Canada and our VP education of the club. She's an HR by profession, and you know how HRs are. I don't need to tell you that. But let me invite the presiding officer for today, Toastmaster Vrunda.
Thank you, DTM Raghu. Welcome, fellow Toastmasters and esteemed guests. It's my privilege and pleasure to welcome you all to this edition of the Sattvic Toastmasters meeting. As presiding officer, I would like to recognize any guest we have today. I see that we have some guests. Would you like to introduce yourself and let us know from where you are joining us from? I can see Moise. Would you like to unmute?
Yes. Fellow Toastmasters and distinguished guests, this is Moise Nahi. I'm from Pakistan, Karachi, and right now, as DTM Raghunatha introduced, I am serving as Division P Director, which looks after clubs in Karachi and some online clubs. Over to you.
Great, thank you. I can see Lutfi. I hope I'm pronouncing your name right. Would you like to introduce yourself?
Fellow Toastmaster, I am Lutfi from Lipo Karachi Toastmaster Club, Indonesia, Division 87. It's nice to see you. Over to you.
Yeah, welcome. I can see, let me see who else is new. Chandra, you're a familiar face, but would you like to introduce yourself again for the rest of the people who are new here or who don't know you yet?
Yeah, sure, Vrinda. Hi, everyone. I'm Chandra from Nizampet Toastmasters Club. So I work for Oracle, and currently, like say, I'm part of, like say, whenever possible, I attend these meetings, and it's quite informative. And thanks for hosting an education session as well. Back to you, Vrinda.
Thank you. I think we'll now continue with our next session of the meeting. We have a very interesting meeting and very insightful keynote lined up. So without further ado, let me hand over to the Toastmaster of the day, DTM Raghu. Over to you.
Thank you very much, Toastmaster Vrunda. As they said, a Toastmaster wears different hats. That doesn't mean that we have a nice collection of hats. It's all about the different roles that we take, especially in the meetings. Outside the world, you don't know, at least in Toastmasters. Well, as a Toastmaster of Day, it's my responsibility to host the meeting. And this role is important for everyone. I think every Toastmaster must try the Toastmaster of their role. It helps you to manage the event. It gave me confidence to be an event manager at one of the personal events. And we did well, I think, because that confidence I would have never got if I never played this role. At that time, talking about the theme of the day, how do you manage chronic kidney disease. Most of us, we don't know even about the disease that's happening. Most of us know whether we are affected by it or not. Because as in the words of the Dr. Mary Thomas, who's a good friend and also one of the advisors for this club, most of the doctors, they don't try to go into the root cause analysis of what's happening to us. They just go and then just keep advising and giving us some medicine to reduce the side effect rather than doing the deep analysis and then trying to find out the root cause and then giving medicine to it. It doesn't happen that way, right? So this is why most of the time people don't even know they're affected by chronic kidney disease until they're in stage 3 or stage 4, sometimes in a fatal situation. And today we have a keynote speaker joining us from the United States talking to you about it. But before I introduce her, let me introduce the role plays for today. We have timer for today, Toastmaster Radhika, but Radhika is still facing issues. But before that, let me introduce the R counter for today. And R counter is our newest member, but he's not new to Toastmaster, of course. Ashish Sinha. Will you introduce your role as R counter for today?
Thank you, Raghu. Thank you, DTM Raghu. And hello, fellow Toastmasters and dear guests. So I am Ashish and I would be the R counter for today. So R counter is an interesting role. Objective of our speech is that we deliver a message through our speech. Now, if you have any fillers in betweens, or if you have any crutch words in between, which you are repeating, then the message what you want to give to the audience is not delivered properly. And there is where I come in. I note those fillers and crutch words, and I would be presenting my report at the end so that it can be helpful for you to improve in upcoming meetings. Thank you. Back to you, TM Modi.
Thank you very much. Let me invite the grammarian for today, Toastmaster Shahid.
Yeah, thank you, DTM Raghu. Good morning, good afternoon, good evening, fellow Toastmasters. Today my role is grammarian. As a grammarian, I will look at the good usage of the words, and today we have word of the day and idiom of the day. And today word of the day is resilience. Its meaning is the capacity to recover quickly from difficulties and the toughness. An example using this word, resilience is an important trait for success in any field. I will post along with the meaning in the chat group. And the idiom of the day is bigger fish to fry. I repeat, bigger fish to fry, meaning more important things to do. So an example, don't waste my time with silly little things today. I have got bigger fish to fry. So both the things I will post in our meeting chat. Try to make use of this while using your speeches in the table topics and wherever the possibility is there. Thank you for giving me this opportunity. Over to you, DTM Raghu.
As a human being, rather as a married person, rather as a husband, we all are resilient, irrespective of all the tauntings that we get from our wives. I'm just kidding. I don't mean that. It happens other way too. And then we have bigger fish to fry for another day. But today it's all about the keynote speech that we have. Toastmaster Kathy. Let me introduce her before I invite her. Kathy is owner of Kidney Nutrition Care Center located in North Carolina. She has been a registered dietitian for 15 years now, and she has recently started her own practice this year. She also leads a Facebook group to help people with kidney disease who want to slow the progression of the disease by making dietary and lifestyle changes. So you should be a part of that group. She keeps advising her and she gives a lot of time there. That's the best thing. She also has a podcast called Kidney Care Conversation. She's on a mission to help people become more aware of kidney disease and help them avoid or delay time to dialysis. Kathy joined Toastmasters about 6 months ago and enjoying getting to meet new people and learn to be a better communicator. And today she is here and a part of our mission to extend the knowledge on chronic kidney disease and also how we can avoid or rather delay the effects by the nutrition changes that we can do to our diet. Before I invite her, do you want to quickly check your sharing ability and your voice, Kathy? You're on mute.
Okay.
Yeah, you can go to. Okay. Will you be using the same way or will you be going on slideshow? You can use slideshow.
Yeah, I'm trying to get to it. Okay, here we go. Okay, how's that?
That's cool. The timing is, how do you want to time? 15, 18, 20, and then you can use 10 minutes as question and answers. Is that good?
Yes, that's fine.
So green at 15, yellow at 18, and 20 with the red. Thanks.
Good evening, and thank you for listening to my speech tonight. I'm going to be talking with you about chronic kidney disease. Every day and every week, I hear people, I have clients that tell me the same thing. They come in to see me, or I talk to them on the phone, or I talk to them on the computer, and they're very upset. And they say to me, why didn't anyone tell me before that my kidneys were bothered or not doing well? They tell me they've looked in their labs and their medical history, and now that they know about it, they see that it's been going on for years. And they say, is it too late for me to avoid dialysis? I don't want to be on dialysis. They ask me if they're going to live much longer. They ask me if they're going to be able to survive if they have to be on dialysis. And they are oftentimes very angry because they lost opportunity to make changes to their diet and their lifestyle in order to take care of their kidneys. Across the world, millions of people have this healthcare problem that is silent and has no noticeable symptoms. Chronic kidney disease means that kidneys are damaged and they don't filter as well as they should. Worldwide, 850 million people have chronic kidney disease. In India, 7.8 million people have kidney disease. And in the United States, 37 million people have kidney disease. These numbers are actually a few years old, so the numbers are probably growing and higher at this time. But that's the most recent data that we have. Did you know that you don't usually show signs of kidney disease or signs of problems with your kidneys until you've lost almost all of their functioning capacity? I'd love for you to let me know in the chat box. Did you know this? Did you know that you can have kidney problems and have no idea or awareness that you have this going on? That's the answer that I get from many people. No, they had no idea. Most people also think when they go to their doctor that they can count on their doctor to let them know what's wrong with them and what they need to do to take care of themselves. However, many doctors are not telling people that they have kidney disease. Your kidneys can take care of you just fine until they are functioning at only 15% or less. And so you can, and that's why there's no symptoms for a really long time. So your kidneys could be barely functioning and you still could not have any symptoms. What's even more shocking is that 90% of these people that have kidney disease aren't even aware that they have this problem. So out of the 850 million in the world, that's 765 million people that have kidney disease that don't even know that they have kidney disease. That means over 7 million people in India have kidney disease and they don't even know that they have kidney disease. Most people aren't told about their kidney function until they are at about stage 4. When you're at stage 4 of kidney disease, that means your kidneys are functioning somewhere between 15 and 29% as well as they should. By the time your kidneys are functioning at that level, an individual has lost a lot of valuable time for making changes to slow down the progression of the disease. That means many, many people don't find out until it's too late to make a lot of changes that are going to slow down their time until they need dialysis. However, there are only 2 simple tests that you need to be able to know if you have kidney disease. And when you go to the doctor regularly, most of the time these tests are, the blood test that is required, most of the time is checked. And most of the time physicians see these values, but they may not choose to tell you if they notice that they are declining. First, a simple blood test can be done. Generally, when you go to the doctor and you get your blood checked, this is in the panel that they're checking. Your GFR is a rough percentage of how well your kidneys are functioning. That number is right there on your lab report. Your creatinine is a toxin that your kidneys help filter out of your blood and into your urine. If your lab work shows elevated creatinine, that means your kidneys are not clearing the toxin as well as it should. Also, when protein is broken down in our body, it produces BUN, or urea nitrogen, which is another toxin that has to be removed from our blood. And that's on that blood panel as well. So if you look at your blood results, you can tell very easily if you have anything going on with your kidneys. The second test is a test that's not performed as routinely. That's a urine test. It's a simple spot urine test, and that is measuring the ratio of albumin to creatinine in your urine, which means that you're spilling protein in your urine. Knowing that your kidney function is lower than it should be can make you aware that you are at risk for further decline. It doesn't take very much protein being present in your urine to show that your kidneys aren't working as well as they should. So if someone has either one of these indicators, either their GFR is low and their creatinine or BUN is elevated, or protein in their urine, that means they're at risk for progression of kidney disease. If someone has both protein in their urine and abnormal labs in their blood results, that means they're at an even greater risk for progression of kidney disease. So it's very important that people who are at risk for kidney disease have their blood checked regularly and also have their urine tested regularly for albumin to creatinine. People need to be informed that they have kidney disease as soon as possible. The earlier you make changes in your diet to help, the more you can change and slow progression. Many times providers tell patients don't worry about these numbers. I mean, even if you notice that they're altered and you ask, what does this mean? Many times providers say, don't worry about it. It's just part of aging. It's normal. However, there are proven lifestyle changes and even medications that can help slow progression of kidney disease towards dialysis. So recently there was a study done in Australia, and they asked healthcare providers what they thought about kidney disease and whether they thought diet was important in slowing progression. And most of them agreed that it was important. However, as you can see here on this graph, the overwhelming majority of healthcare providers referred patients to a renal dietitian that specializes in kidney disease 50% or less of the time. The majority of them, the largest group of them, referred their patients to a dietitian. It's stage 3, 25% of the time or less. Most patients ask about nutrition and renal health, and most patients, professionals, do believe that diet can reduce progression. However, they report that they don't think that there will be positive outcomes if they send patients to a dietitian. They don't think that patients would adhere to the diet. And they also don't want their patients to have additional doctor's appointments. So those are the reasons that they say that they don't tell people that or send people to the dietitian. So moving on further, what can you do in your diet to take care of your kidney disease? So there's been a lot of great research that's been done to tell us what we can do with our diet to take care of our kidneys. Red meat and processed meat have both been shown to have an increased risk of CKD, and it also causes a faster progression of kidney disease. It's also been found that replacement of even one serving of red meat or processed meat, such as luncheon meats, hot dogs, those kinds of things, sausage, bacon, even replacing one of those servings with another protein source shows a reduction in kidney disease risk. Also, many people with kidney disease have blood that is too acidic. And a lot of times a medication is prescribed called sodium bicarbonate to treat that. But research has shown that increasing someone's fruit and vegetable intake can improve that acidity in your blood just as effectively as the sodium bicarbonate. So the makeup of our diet is extremely important in terms of our kidney function. If individuals are going to be able to slow their progression of kidney disease and avoid their risk of having to be on dialysis or even delay their time to dialysis, they need to be made aware of the problems that are associated with their current dietary habits, and they need to be educated about what they can do to make changes and improve their health. More research is needed. We don't know all the answers about preventing kidney disease and about keeping people off of dialysis. We don't know all the answers about what our diet needs to look like 100%. But we do know that plant-based diets definitely have an effect on slowing kidney disease down. Some people ask, do I need to be vegetarian? Do I need to be vegan? The research is not very clear about that, but it is becoming more and more compelling that perhaps there is a role for vegetarian diets. However, when I work with clients, I like to work with them where they are. Some of them are not ready to become vegetarians. So we work together to develop goals to help them make slow changes to their diet that they can sustain and that they can continue to follow. And we follow their lab work while they're making these diet changes. And it's so exciting when I get to see patients' lab work and I get to see the look on their face when they realize that the changes that they've made in their diet, like cutting their sodium down, cutting out red meat or processed meats, incorporating more nutritious fruits and vegetables and nuts and seeds, has made a huge difference on their lab work. Sometimes they don't need as much blood pressure medicine. Sometimes their diabetes medication can be adjusted. But even more importantly, a lot of times they see improvement in their kidney disease numbers. That does not mean that they have cured the kidney disease. But what it does mean is that they're taking care of their kidneys so that they can delay or even totally avoid dialysis. In some cases, people are able to get a kidney transplant before they ever have to start dialysis, which is really amazing. I hope that this has been informative for you. I hope that it is something that you can tell other people about and help me in spreading my message about kidney disease so that we can help people stay off of dialysis. I am happy to answer any questions that you have.
Thank you, Kathy, for the informative session. So I had one question. How often should we do the tests, what you mentioned, the 2 tests, and how should we analyze it? Yeah.
So the tests are generally done once you identify that you have a kidney decline in function. Generally, they're done every 3 months or so. It doesn't necessarily always have to be every 3 months. It could be a little bit farther apart once you see that your kidney function is stabilized, but you want to continue to monitor it and you want to watch for trends. So you hopefully are going to see, what you want to see is that the numbers are staying stable and you're not seeing lower numbers every time you get your blood work done. They may fluctuate a little bit. Say it's 55, then it might be 54, then it might be 56, but you don't want to see a general decline every time. That's a sign that your kidney disease is progressing. Now, with the protein in your urine, if the number is more than 30 milligrams per gram, then that is putting you at risk for kidney disease. So it doesn't take very much protein in your urine. Now, oftentimes people have as much as 5,000, 8,000 milligrams per gram of protein in your urine. So you can have a lot of protein in your urine. You can also know that you have protein in your urine if you have really foamy urine, kind of like the foam that beer produces when you pour beer. If you notice that your urine becomes more foamy, that would definitely be an indication that you should kind of ask to have your urine tested for protein in it. So your blood work is generally checked regularly. They may not tell you about it, but you usually have that data. But urine is, even if you do a urine sample, that doesn't mean they're doing a albumin to creatinine ratio. So you have to specifically ask about that question.
Okay, thank you, Kathy.
I'm having a question.
Okay.
Yeah, thanks for giving us some idea about this disease. So if one is having a kidney stone issue, kidney stone. Yeah, so what do you suggest, like what frequency he or she should get his tests done, and what diet one should follow? And is kidney stone a chronic issue also?
So some people have one incidence of a kidney stone and then they don't ever have a kidney stone again. Other people, like my father, just seem to generate kidney stones chronically and always have them. So it can be a wide variance there. What's important to know if you have a kidney stone is what type it is. oftentimes they don't tell you that. So you need to know whether it's a uric acid stone or whether it's a calcium oxalate stone. Those are the two primary types. There are some rarer types, but depending on which type you have will depend on your diet restrictions. So if you have uric acid stones, then you follow a diet similar to what the recommendations are if you have gout, because gout is an elevation in uric acid. So it's similar kind of restrictions. If you have calcium oxalate stones, then you have to monitor your calcium intake. And then there are certain foods that are high in oxalates that you would want to be careful of consuming. Either type of kidney stone, you need to drink lots and lots of water to help keep your kidneys flushed. As far as the testing, I would say at least when you have your annual physical, your annual checkup, you should probably look at your lab work. And then if you see that you have a decline in kidney function, you might want to have it checked more frequently. Ask them to draw your blood more frequently. A lot of kidney specialists don't have the capacity to see everyone that has early stages of kidney disease. But if you can find a nephrologist that is willing to see you, especially if you're seeing your kidney function decline, that can be really valuable because they can help identify the issue and take care of the issue, the underlying cause of your kidney disease.
Okay, thanks for this. So it's like a calcium oxalate stone, and you answered that also. So thanks for that. And if the stone is detected, so you are saying that we should drink lots and lots of water, right? Okay, yeah. Okay, thank you very much.
Ma'am, can I?
Moise, go ahead.
I would like to ask a question that what I got a message from your thing from your keynote is that protein is excess of protein is harmful for the kidney. However, if I asked in my culture, we have a culture that we eat a lot of meat. We eat a lot of meat, like chicken, mutton, like beef, and a vegetable is not considered a elite food in our culture. So how, as you have mentioned, that many of your patients are planning to become vegan or are not those patients or those people to move to the healthier diet.
So if your culture includes a lot of meat, you can certainly continue to eat meat. What my recommendation would be, we know for sure that red meat, so things like beef and pork, are much harder on your kidneys than poultry and fish. So if you can limit the beef and the pork to less frequently than you maybe have been, and more often do fish and chicken or turkey, and maybe have beans some of the time instead of meat, then that would be better than doing nothing. The other thing you can do is limit your overall portion size of meat. So we do know that limiting the total amount of protein is also helpful to the kidneys, because every bit of protein we eat has to be metabolized, and it has to remove that urea, nitrogen that I was talking about. And so by reducing your total protein intake, so if you eat smaller portions of meat, you're going to overall help make your kidneys not have to work as hard. But there is great value in the fruits and vegetables, the nuts and the seeds. So any way that you can increase those in your diet would definitely be very beneficial, because meat and dairy are more acidic, and these other foods, fruits, vegetables, nuts, and seeds, help balance the pH in our blood so that our blood doesn't become more acidic than it should be. And that's that's one of the areas of research that we know is playing a role in all this kidney disease that we're seeing.
Ma'am, this I would like to ask that in our religion there is a festive in which uh, basically for a goat or a cow is being slaughtered, and after that we have a lot of barbecues. Like, so if any person who is having kidney disease, but we know for sure that a season is coming and a lot of barbecue and lot of such eat outs will be increased. So do you suggest any medication to reduce the impact of, we know that a season is coming and a lot of meat we are going to eat, or if we reduce, we are going to eat some of it. So is there any medication we should take to reduce the impact of meat or improve our digestion, improve our processing of metabolism to digest or to process that meat efficiently in those seasons particularly?
Well, that's a very interesting question. I would for sure make sure during that period of time that you're very well hydrated and you're drinking plenty of water, because that plays a big role in making sure your kidneys are able to filter appropriately. So if you know you're gonna be having that period of time, then I would definitely be hydrating and maybe just watch limit the overall amount that you eat if you know that's what's going to be served. So I don't know how it is in your culture, but in the United States, we can, like, sometimes what I have patients do is they have a snack at home before they go to an event so that they're not as hungry, and then maybe they don't overdo it on those foods that are more harmful for their kidneys. They can still partake, but maybe they don't eat quite as much because they've already had part of their meal at home. That's just some ideas. I'm not aware of any medication, but what is interesting is there is a lot of research on the gut and the effect that our gut bacteria has on our kidneys. That's a very, very big research area right now. And there is some evidence that probiotics can be really beneficial for your kidneys. And so I would not, I think it would definitely be safe to say that it would be good to be taking a probiotic during that period of time.
Thank you so much.
Thank you. Shahid, you had a question?
Yes. Yeah. Thank you, Kathy. Thank you for that insightful session. And my question is like, so everyone is asking when to go for the test and all, right? So if you are healthy, so what is the major symptom we observe? So we have to go for a test, or one or two symptoms in our day-to-day life, which we can observe.
So the biggest thing, if you are a healthy individual, is if you know you have a family history of kidney disease, you would still want to be aware of, you would want to monitor your labs closely. If you have controlled blood pressure, high blood pressure issues, like even if you have high blood pressure in the past, but you're taking medication that has controlled it, you're still at risk for kidney disease. If you have diabetes or pre-diabetes that you're managing, you're still at high risk for kidney disease. So, and then there are genetic causes of kidney disease. So even if you're healthy, you definitely want to keep an eye on it. You probably don't have as high of a risk as other people, but it's still something to be aware of. And there really aren't symptoms. So kidney disease is kind of a tricky name because it's not really a disease. It's really an indication or a label for how your kidneys are functioning. So if you go to the doctor, or maybe say you have an emergency and you're in the emergency room, they need to have a quick way of knowing if your kidneys are healthy or not, because there are medications they can't give you if you have kidneys that aren't working so well. So calling it kidney disease gives us a label that the healthcare providers can quickly see, okay, she has stage 3 kidney disease. We can't give her these medications. So it's not like cancer and the stages of cancer. It's very different, but having similar names makes people think that it is. But there really aren't symptoms. And so that's why you've really got to pay attention to your lab work. It's really difficult when people don't go to the doctor and then they have a crisis and they get diagnosed with kidney disease and they want to ask, like, what are the chances it's going to improve, and what's this going to look like? If we don't have any lab work history, we don't really have any data to tell us, is this a new issue? Did you have an acute crisis? Have your kidneys been declining for years? So just getting your blood work checked regularly is super important so that you have trends. So I recommend that you I give my clients a tracker to track their kidney labs. And so they can quickly look on their tracker and see what the trend is.
Yeah, thanks, Kathy. And one small question is like, once the patient went to dialysis phase, is it reversible?
So there are times when people have what's called an acute kidney injury. So they end up in the hospital and their kidneys are not functioning well, and they have to do dialysis urgently to get their kidneys stabilized. And sometimes you're able to come off of dialysis. Some people have already damaged their kidneys so much that you just know they're not going to improve. You can't. So basically, when you have reduced kidney function, each of our kidneys has about 1 million tiny little filters. And basically you lose the functioning of those filters. So once those filters don't work, we can't create new ones. So if you've gotten to the point where you don't have those filters, you're not going to be able to come off of dialysis. There are times, however, that people go on dialysis because something acute happened, and then their kidneys are able to recover and maybe they're able to come off of dialysis. But those are less often than they are often. The other thing I will say, that's a good point, is that some people choose not to go on dialysis. And there are extremely low protein diets that you can be on to help stay off of, to help prolong your life as long as possible. But a lot of doctors are hesitant to recommend those. They need very close guidance with a dietitian, because you have to really, really closely monitor your intake to make sure you're getting all the nutrients that you need.
Yeah, thanks, Kathy.
Thank you very much, Kathy. I know Vrinda has a question, but in the interest of time,
Yep.
Vrinda, probably you can ask offline, because we have a speech by Vrinda now. Kathy, thank you very much for joining the meeting and giving that insightful information on the chronic kidney disease, because as you already mentioned, most of us don't even know about the chronic kidney disease, and most of the patient doesn't even know that they have the disease. This is something insightful for us to know. Probably we can do a follow-up session on this, where we can have more insightful, probably can analyze few of the reports and show us how to analyze the reports and how we can do our self-analysis on this, and also something more than that. Thank you for joining today. We are grateful for your information that you shared today, and we'll share your virtual certificate online. So that's at least that we can do as a token of appreciation for us. On that note, let me proceed to the next part of the meeting, which is a prepared speech. And we have a prepared speech by Vrinda. And I will let her speech evaluator, distinguished Toastmaster Lisa Thompson, introduce her. Lisa, you there?
I am here. Okay, hi. Kathy, that was wonderful. I was just throwing into the chat that you will be appearing the first and third Sunday of each month at Kidney Stories Toastmasters, and everyone's welcome to join and ask additional questions at that time. So tomorrow night we are meeting, and Raghu's coming, Chandra's coming, Kathy and I will be there talking about coping strategies for the kidney community, and you're all invited. It's up on Nomadic Toastmasters. However, at this point, what we want to do is to introduce your next speaker, and Vrunda is speaking, and she sent me her evaluation, so I just want to read the purpose. And the purpose of this project is to develop and apply skills for coaching a fellow member or a person outside of Toastmasters who can benefit from Vrunda's expertise. So I'm looking forward to hearing about effective coaching from Vrunda. And back to you, Master Toastmaster Raghu.
Sorry. Vrunda, do you want to quickly do your audio video check?
Yeah, can everyone hear me?
Perfectly.
Yes, we can hear.
Great.
Okay, you're right. Wonderful. I don't have your title, Vrunda. Do you want to share that?
Yeah, unlocking the power of positive coaching, a mentorship journey.
Unlocking the power of coaching.
Positive,
Toastmaster
yeah,
power
go
of
ahead.
coaching.
Yes.
Oh, can you repeat that?
I'm sorry, I had remembered to give the title, but I forgot. So the title is Unlocking the Power of Positive Coaching, a
Okay.
mentorship journey.
Probably I will restrict it to mentorship journey, make it short.
Yes.
Toastmaster Vrunda, a mentorship journey, Toastmaster Vrunda.
Hello, everyone, fellow Toastmasters and guests. Let me begin by asking you a question. How many of you have had a mentor in your life? I'm not going to ask about Toastmasters because most of us in Toastmasters would have had a mentor. Apart from Toastmasters, how many of you had a mentor? Just by a show of hands. Okay, quite a few of you. That's great. So I didn't have a mentor when I started my professional journey. And for the longest time, I've been navigating my career path on my own, whichever opportunity sounded great. I've been going zigzag, zigzag. That was my career journey. In about 10 years back, I became a certified HR professional. It's called Certified Professional of Human Resources. Or sorry, not certified, Chartered Professional of Human Resources. And we have a chartered professionals organization. And in that organization, we have senior HR professionals and new to be professionals. And that's where I got introduced to a formal mentorship program. Again, out there, I didn't even know that mentorship would play a role. So I was like, would you need a mentorship? I am good. But I saw the value of it when I actually very casually went for a introductory program about what the mentorship journey is all about. Then I realized that it's such an investment wherein a person works one-on-one with you and works on your career profile. And it could be anything, your choice of career, your choice, your aspiration could be anything. But this is the person who is going to listen to you and give you options. All you need is commitment. I said, okay, that sounds good. Let me sign up. And I signed up. I got matched with a mentor who was a professional. She used to train business coaches and chiefs of industries and so on. So that was something enlightening. I said there's lots to learn. And we started on my journey. I worked with her for a year. And believe me, my change in my outlook towards work, my outlook towards how I behaved or showed up at work changed drastically. There were things where I would be afraid to speak or would not articulate as much, and she challenged me to do things. And I got so inspired that very next year I signed up to become a mentor. And this has been about 3-4 years now that I've been mentoring other people. Until then, I didn't even know that I could mentor people. But she kept on saying that you already have so much of experience. Why are you not doing your own mentoring? And I was to say, oh, who would be interested in knowing? And the first year when I offered my mentorship, I mentored about 5 people. The second year, that number increased. And I was surprised that there are people who are interested in learning from me. I started mentoring not just in the HR circle, but I also started mentoring with the immigrants, the new immigrants that come over to Canada. So I live in Canada, and there is an Immigration Council BC, wherein new members are welcomed and they are trained and coached on how to adapt themselves to the workplace in BC, or basically in Canada. That's how I met a girl called Anna. Anna was new to BC, new to Canada, and she came from Russia. She came at a time when the war had just started, and she was not familiar with what's happening in Canada. She was applying for roles and was not successful. She was a manager, an HR manager in her home country, 10 years of experience, and she was not even able to get interviews. She struggled, and it was hard for her to go back because the war just started after she landed in Canada. She was extremely disappointed, and that's when I met her. We discussed on our goals, how we could improve on her HR strategies. We divided our goals into small chunks. The first part was working on a resume so that she could apply for appropriate roles. Then it was about interview coaching. And the third part was the workplace culture. The first part, resume, that's where I was working with her, because the first thing that I noticed was she was not able to catch up or speak more about herself. It was all about somebody else. I contributed to the team. Our team did this. Our team did this. And from there on, I started coaching about how she could speak about herself rather than the team. Then came the interview phase. Again, the same part, not confident to speak to an audience, especially about self. But slowly, from a place where she was not getting any interview calls, here she is today. She even got roles in a government organization. Today, she's in the final stages of her interviews and is very soon likely to find her chosen employment. From a shy girl, she's become somebody who's able to talk confidently today. And not only that, she has realized the value of mentorship, and she is going to spread it forward. So my call to action to every one of you is, if you have not invested or found a mentor in your life, find a mentor. Once you find that mentor, stay committed to whatever goal you are. It's a two-way relationship. And once you do that, spread the word and mentor more people. With that said, I hand it over back to you, TMOD Raghu.
Wonderful. Thank you very much, Toastmaster Vrinda. Now it's time to have some fun with our table topics with our distinguished Toastmaster Pramod as the table topic master. When I say fun, it's going to be fun. And Pramod is going to ensure that. Pramod, all yours.
Thank you, Raghu. Good morning, good afternoon, good evening, Toastmasters and dear guests. Let me tell you something about table topic. It is a session where your ability to think on the feet and speaking off the cuff is tested. Like Raghu said, it's an interesting session. Even guests can also participate. How does it work? I will invite one of you to the stage or virtual stage, and we'll give you a topic. you have 30 seconds to think about the topic, organize your thought, come out with stories, whatever you want to. After 30 seconds, you can start. So you have a total of 1 to 2 minutes. When you see the green card, congratulations, you have completed your 1 minute and you became eligible for voting as the best speaker, which we don't follow in this club. You have a total of 2 minutes. When you see the red card, think that it is time to wrap up your speech. After that, you have 30 seconds. That's the simple rule of table topics. Today, I'm going to give you very generic, simple topic that you can interpret, you can talk on anything. Okay, without wasting much time, let me invite one Toastmaster who is experienced so that he or she can show or talk like a demo speaker. Can I call Chandra is there? Chandra?
Yeah, Toastmaster Pramod, I'm here.
Yes, Toastmaster Chandra. I would like to start with you. Very simple topic, Chandra. What gets you excited in life? What gets you excited in life?
Table topic master, fellow Toastmaster, and guest. Something which excites me in life is the progression. Where I am currently, if it is dependent on my past actions, what I am today is going to be affecting my future. I always look for growth, be it a small, tiny growth or a big leap of growth. It doesn't matter for me. All that is important is I'm excited about growth. I work towards it and take a baby steps one day after the other and slowly reach a point so that I can see the significant difference, which I can witness not only in terms of, since the topic for today is I need to be persistent about my health and ensure I'm also resilient enough to put the time and accommodate not only time. So there are many problems like which we are facing as on today. I would like to break that to three parts. One important thing is the physical health. The second thing is the mental health. And the third important thing is improving energies. So when we have like a lot of big fish to attack, so definitely these will be taking the precedence and we need to be resilient enough in such a way. We work towards what is important and prioritize them. And ultimately, we will be reaching like what we wished. And we can see the significant difference with these baby steps, which will also eventually lead to a big difference. That's what I'm excited about. So to summarize, progression is something which I look forward and I see that happen with the results which we witness. Back to you, Table Topic Master.
Thank you, Chandra. Thank you so much. It was a proper demo table topic speech. Now, I would like to call one of the guest Toastmaster Elios. Elios, are you ready for a table topic session?
Yes.
Yes. So, Elios, your topic is the one thing which you have not done in your life so far, but which you really want to do. The one thing which you have not done so far in your life, but you really want to do.
Hi, my fellow resilient people. How are you today? How many years you have survived during the pandemic? I think it's already 3 years, right? And do you have bucket list in your life? Maybe one, maybe two, three, four, five, six, seven, eight, nine, 10, or maybe you have hundreds of things to do. Well, I just have one things that I really want to do. It is just to survive. Even though pandemic, we quote unquote say to be done, we still have bigger fish to fry, which is the art of living itself. How you can make sure that you not only survive, but you thrive in your life. So that's only one thing that I want to do. I still remember when I woke up in the morning, what did I do yesterday that can make me better today? And what will I do tomorrow that I'm planning today? And that's it. I keep on this cycle repeating again, and again. Basically, I implemented what I have learned in Toastmasters into my real life. Prepare speech. I need to prepare it for tomorrow. Impromptu speech. I need to prepare it now. And evaluation is, yes, you know it. I need to evaluate what I did on the past. So yes, my fellow Toastmasters, that's it. My one thing I really want to do. Implement Toastmasters in my real life. Are you with me? If you are with me, type Toastmasters in the Zoom chat because that's where readers are made. Take the UTTM.
Thank you, Leo. Just a reminder for all of you to use the word of the day and idiom of the day. Word of the day is resilient, and idiom of the day is to catch a big fish. Right? Shahid, am I right about idiom of the day?
Idiom of the day, the bigger fish to fry.
Okay, bigger fish to fry. Sorry. And now let me invite a guest. She's not a guest, she's part of Toastmasters. Almost every meeting she attends, it's Toastmaster Kanika Gupta. Kanika, I have a topic for you. Unmute and speak on the topic. Your topic is the one thing that if you do will make your life improve 10 times. The one thing that if you do will make your life improve 10 times.
Okay. So yeah, am I loud and clear?
Yes.
Okay. So thank you, Pramod. The idiom and the word of the day that has been provided to us today is the only my answer. The current situations that I am facing in my college is like the answer as same as what is resilience. The thing is, I want to improve myself from the past that I had done. Whatever mistakes I have done, I want to improve myself. And the key factor that can help me today is only resilience. Because I have bigger fishes to fry in my near future. So, if you wanna improve yourself, if I wanna improve myself, I want to come myself from that stage and think about how can I improve better. I need a mentor. I need self improvement. I need self judgments. And the most important thing, perseverance and consciences. Perseverance and consciousness. These two factors will help me a lot. One more important thing I want to say that it's not about me only. If any among us want to improve, you have to stay upon the things. You have to commit upon the things you want to do. That's it from my side. Over to you, sir.
Thank you, Kanika. Thank you so much. Now let me call my last speaker. I'm calling Lufti Fauzi. Lufti, are you ready?
Yes, I'm ready.
Okay, Lufti, when you think about home, what comes to your mind first?
My fellow Toastmasters, home has a similar definition for most of the people. I think it's safe to assume that home is a place that you can come back safely, comfortable, etc. So home is not only defined as a place, but person, a mentor, a colleague can also define as a home. There is a unique experience of mine that previously I had a bunch of activities to deal with that seems like to decreasing my resilience. And it's a good fortune for me that I had a excellent mentor, and he is something that I can call a home. Someone then I can ask for suggestion, or someone can give me a suggestion to keep growing, because he always suggests me and told me that instead you are complaining about the hard, difficult situation, you have to pursue your bigger fish to fry. Thank you. Over to you.
Thank you so much, Lufti Fauzi. Thank you so much. I really enjoyed the session, everyone. I really enjoyed being the table topic master of the day. Hope you all enjoyed. Let's go for the voting for the best speaker. I think the poll is already up. So we had 4 speakers, Chandra, Elios, Kanika, and Lufti. They have qualified to be voted as the best speaker. Please just use your mouse and vote for the best speaker. It's on the screen already. It's kind of encouragement. With those humble words, let me give control back to our Toastmaster of the day, distinguished Toastmaster Raghunath Raju. Over to you, Raghu. Thank you.
Thank you very much. Come on. Welcome back. Now, as they say, feedback is the breakfast for champions, and it's almost breakfast time in India, and I should start preparing that for everyone, at least the family here, Toastmaster family. So in the preparation, let me invite the evaluator for the speaker today. That's from Vrinda. It will be distinguished Toastmaster Lisa Thompson. Lisa, can you please evaluate Vrinda's speech?
With pleasure. Brenda did an amazing job talking about effective coaching, and particularly about her journey in having a mentor, as well as her journey in being a mentor. And there was a lot of great information. It was well organized. I love the way that you started with a question, Veranda, and ended with a call for action. I think that really helped to engage your audience. I love the way you told about yourself and about how you didn't have a mentor for a very long time, and then getting a mentor, and then how inspired you were in having a mentor, that you became a mentor, and that you've been mentoring for several years. I think that your speech would have gained a lot, and that I would have gained as a listener, if it had been announced in advance how it was being structured. So the structure was clearly there. However, it would be really good if you could name the 3 parts, perhaps the history, and then your experience with having a mentor, and then your experience with being a mentor. So if you had said that to start with, that would have made it easier for me as a listener to your speech. The other thing is that you might want to challenge yourself by doing a PowerPoint to increase visual interest instead of just watching a talking head. The other thing is that there were 3 parts that you went over and you mentioned them and then you went into more detail. I think that if there had been an acronym for those 3 parts, that it would be easier for me to remember them. So you talked about how you helped the speaker to talk about herself, and then you helped her with the interview, and then you helped her with further stages, something like that. If you could make that into some kind of an acronym or a phrase that captures those 3 stages, so that when people start mentoring others, they have a clearly defined structure for how the mentoring will work. I think that in your call to action, you did a great job in conveying the importance of commitment, and then it's a 2-way street. And I think overall it was excellent. Very, very well done speech. And I'm so happy that your clients and your mentees have benefited from your mentoring. So thank you so much for doing that speech. I rest my mic. Back to you, Master DTM Toastmaster Raghu.
Thank you very much, Lisa. Now it's time to evaluate the meeting proceedings. And let me invite the grammarian for today, Shahid, to present his report.
Yeah, thank you, DTM Raghu, and thank you, everyone. And as a grammarian, so it's my privilege to present today's report. And today, most of the people have used word of the day and the grammarian of the day. And in the table topics, one of the speaker has taken these as the main things for them. So today Raghu used once the word of the day resilience, and Chandra used twice word of the day and once idiom of the day, and Toastmaster Ilios used both, once word of the day and the idiom of the day, and Kanika used twice word of the day and once idiom of the day, and Lufti Faiz used both once. And as per today's session, I have used some good usage of the words, so I'll just repeat them. Amazing job, well organized, excellence, privilege and pleasure, zigzag, small chunks, look for growth, take baby steps, persistence and significant difference, quote unquote, art of living, self-judgment and perseverance, and keep growing. So it's a honor to be a grammarian and to present the report. And over to you, Toastmaster of the day, Raghu.
Thank you very much, Shahid. The one thing I liked about you is the comfort. You were so comfortable today, and then a very good pace. A pace where people can grasp and understand what you're speaking. That's the best trait for any speaker. Thank you very much. And now I invite the account for today, Toastmaster artist, to present.
Thank you, Toastmaster of the day. If we are resilient, then we can overcome our fillers and crutch words. Now, let's see what are the bigger fishes which we need to fry for getting that done. Starting with speaker one, one of the particular point what I noted is you have a very small R which comes in your speech. So it's very, very small. Probably what you can try it is probably see from Raghu. He actually gives a pause while using so that the filler words doesn't come in. That is one suggestion to speaker one. Then coming to TM Modi, there were few repetitions of words like kidney, not, truth, which I could note. Coming to the evaluator one, the crutch word for you is and. I could make out a few of the times that you were using and several times. And for all the speakers, I have noted as quite a few times. So we all need to be persistent, including myself. We all need to be persistent to get over this ums and the crutch words. So all the very best. Back to you, Toastmaster today.
Thank you very much, Ashish. What I liked about you, you just didn't give the report. You also told us how to improve that. That's the best trait of an evaluator, to be specific and at the same time to show the examples how we can improve. Yes, resilience and persistence are the keys to improve and become better. Let me invite the timer for today, Toastmaster Radhika. She's the newest member of the club. And it's good to see that she's able to attend the meeting at last, out of a busy schedule. Radhika, do you want to present your timer report?
Yeah, Vrunda, she took 6 minutes 55 seconds. And Chandra, he took 1 minute 45 seconds. And Ilyas, 2 minutes 11 seconds. And Kanika, 1 minute 32 seconds. And Lufti, 1 minute 45 seconds.
Thank you very much. Were you able to time the evaluator too, Lisa?
Oh, yeah. Lisa, I didn't do it.
Okay, no problem. Thank you very much.
Kathy, I did. Are you referring to Kathy?
No, Lisa, evaluator. So we need to time, but that's okay. Every time there's a room for improvement and we can work upon that. I want to share something today. Chronic kidney disease is not something that we don't know, but it's something that we keep ignoring. In India, especially, we have a trait that once we join a job, we start thinking that we work for living, and we go otherwise. We start living for work, where we spend so much time at workplace, and we think that's cool. Spending more than 12 to 16 hours at work, everything, that's it. That is something, a try to be successful, but we don't know what we're doing. Happened with me too. I started working for long hours, and especially after becoming a software engineer, I used to sleep late, stretch so much time on computer, and at a point of time, around 2015, at 2 to 3 years, I worked for 16 hours a day. And guess what? What it is resulted in? Severe health issues. And then my blood pressure started showing high, and I started ignoring it. It slowly came to a point where I had to start taking medicine for that. But then I was still adamant and not taking precautions. But at some point, I worked on my health and decreased my weight. But then the pandemic hit, and then I became a panda in the pandemic. Started sleeping late, waking up late, eating late. And guess what? After the pandemic, and due to the side effect of vaccine, which most people ignore and they don't agree with me, but my blood pressure hit super high at 180 or 190 by 120. And then even my diabetes came to a point that H1PAC came to a report as 9.6. But then I have seen 3 of my uncles dying due to the diabetes, which resulted in a chronic kidney disease. One of them, the youngest one, died first. My youngest of the uncles, he died with a very young age, and his body was entirely swollen up. The second one, again, the eldest of the uncle, he died where before that they had to remove entire finger from his toe fingers from his feet. The third one died in the pandemic, where he suffered like anything. So he tried to maintain a proper diet. Then I thought I will be resilient and I will work on my health. And that is why I was able to reverse most of the side effects and still working on them. What I would say is, do not ignore the side effects of chronic kidney disease. You never know where it is going to take you. Start working on your diet. Many things, the customs and everything that we follow is only for human beings. We are not for them. Start working on your health today. What helped me was turning into a vegan. Second thing was eating and sleeping on time. I'm not trying to lecture you. I'm not trying to give you another lecture. It is more like giving a compliment of what we discussed today. And as a living example for way that I have been able to work upon myself, you should also be able to do it. Keep watching your health and also your lifestyle, because these are lifestyle diseases. These are not running in your genes. Today, everyone, including infants, toddlers, and you never know when these diseases are going to hit you. So start working on your health. And as Sattvic Toastmasters for healthy living, we stand for healthy living. It doesn't matter where you come from, which part of the world, what is your lifestyle, what is your sex, what is your orientation, what is your religion. What matters end of day is, are you healthy or not? By here, both matters. Your mental health and physical health, right? So I wish you all the best with that note, and may you be healthy. May you make your family healthy. May you make your entire place that you live in, entire world that you live in, healthy. With that note, I give back to our presiding officer for today, and to take it to next level.
Thank you, DTM Raghu. With that, this was a wonderful meeting, lots of learnings. I didn't know so much about kidney diseases, especially when you don't have a disease, you feel that, okay, I don't need to know so much, but I learned so much, and I'm going to follow up with Kathy about more about this. And I'm sure all of us have something to take home. With that said, I would officially conclude this meeting and would also invite for some feedback if anyone is interested in some feedback, giving us some feedback. Let me see in the gallery.
I'll stop recording at this point. I'll stop recording,
Yes.
and then you can take the feedback. Thank you.